All right, good afternoon, guys. It's Jeremy back with the Hospital PT. And as promised in not my last video, but the video before that, we're going to cover today 3 warning signs, or 3 red flags, if you will, that families should be concerned about that often lead to readmission to the hospital. And so, most people think that the most dangerous time during an illness is while you're in the hospital. And it's certainly a scary time, but it isn't always the most dangerous. And that's certainly considering, you have to take into consideration what you're in the hospital for. If you're in the hospital because you just had a traumatic accident, then certainly the first 24 hours in a hospital can be very dangerous, but that's because they're trying to get you stable, or a patient stable from the injuries that they've sustained as a result of the traumatic accident. When it comes to things like pneumonia, COPD, general deconditioning, things like that, other types of illnesses, the safest place to be is at the hospital. If you think about it, you're there, they have the appropriate medications that you have, they have the appropriate staff and supervision that you need in order to get better. And so, again, most people think the most dangerous time after an illness or while being sick is while you're in the hospital. And there's a lot of research and a lot of information out there to indicate that the highest risk period is actually starts after you leave, or after a patient leaves the hospital. And so, research and health service research shows that that a large percentage of hospital readmissions occur within 30 days. And I will tell you that is a metric that is measured by many hospitals. It is at the hospital where I work. We measure 30-day readmissions because those folks and those patients are at a significant increase for deleterious events when they are readmitted to the hospital that quickly. There are a lot of reasons for readmissions. Some of them are planned readmissions, but many of them are not. And that is a goal for a hospital, is to reduce their 30-day readmission rates substantially, if it's at all possible. And so what I want to inform you guys of today, or if you're a patient or a caregiver, is there are warning signs that indicate that things are starting to unravel for you or for your loved one. And so we're going to cover those things today. So I'm going to walk you through 3 mobility warning signs or red flags that we pay attention to as physical therapists. I mean, not in the hospital, we're not there, but if you are a physical therapist, or if there are physical therapists in the home environment or in outpatient services, we see these things as warning signs to indicate that things are starting to get worse instead of better. And so, remember, I'm a hospital physical therapist, right? And part of my job is to determine, can someone function safely outside of the hospital environment? And so when we evaluate patients, we're not just asking, hey, can we walk down the hallway one time? Can you get to the recliner in the room one time? We're asking, can you safely function and mobilize multiple times a day in an environment that is similar to your home environment? And I'll be honest with you guys, that's difficult to assess sometimes in the hospital, because everything is handicap accessible. All the floors are very flat. There are very few obstacles to have to move around. And so we have to get creative sometimes to try to create an environment that is similar to the home environment. And so let's get to red flag number 1, okay? Because another thing I want you to keep in mind is many of the early warning signs of decline are functional, not medical. Okay, so someone's blood pressure may be great, but their ability to function isn't, or it starts to decline before there becomes a problem with their blood pressure, or with their blood sugar, or they're running a fever, or what have you. Okay, many times the signs of functional of decline, or that things are getting worse, can be functional instead of medical. And so let's look at some of those warning signs or red flags now. So red flag or warning sign number 1, they require increased assistance for basic mobility. So are they needing more and more help each day? Or are they getting stronger? If they're needing more and more help, that is a warning sign that something may be amiss. And so let me give you an example. A patient might leave the hospital being able to use a walker and walk down the hallway 100 to 200 feet. They may be able to stand up from a chair. They may be able to go to the bathroom independently or modified independently with an assisted device. And so, but over the next few days after you get home, let's say day 1, they walk to the bathroom alone. Okay, that's consistent with what they were doing at the hospital. Day number 3, they start to say things like, hey, can you come with me to the bathroom? I don't feel safe. So that's indicating that they themselves are noticing that something isn't right. They don't feel as confident as they did 2 or 3 days prior. Day 5, 6, or 7, now they need help standing up. You start noticing there's balance issues, more so than when you discharged and got home initially from the hospital. And that pattern matters. That is a pattern of functional decline. And so when someone gradually needs more and more assistance with basic mobility, that's what we call that. We call that functional decline. And that means that there needs to be some sort of intervention. It may not mean you need to go to the hospital, but it may mean that, hey, I need to let my general practitioner know. I need to let my family doctor know. Or if you're going to therapy, if you were scheduled to go to outpatient therapy after the hospital, and you as a loved one, you bring them to their therapy appointment, you should let the therapist know that, because they will find that information interesting, and also could serve to maybe escalate things if need be. So research in geriatrics shows that increasing assistance after hospitalizations they strongly predict falls, loss of independence, and hospital readmission. So you need to ask yourself a few questions. Are transfers getting harder for myself or for my loved one? Is my loved one avoiding walking because they feel unsafe? Or are they asking for more help than they were before? And so a quick little story about my grandmother. My grandmother fell trying to get on her bicycle at 82 years old. Okay, she fell. She broke her forearm because she didn't quite lift her leg high enough, and she stumbled and tripped and fell. Well, it was a pretty simple fracture. It wasn't a compound fracture. She went and had it braced, and they put a cast on her, and it healed fine. Over the course of about 8 weeks, it healed fine. My family and I, we go visit her and my grandparents probably once a week or so, just to have dinner with them, check on them, see how they're doing, make sure they're doing okay, if they need help with anything, so on and so forth. She's very independent and did not need any kind of cane or walker or anything like that. She just had an accident, fell, broke her forearm. And we were over there visiting her after she had it, had the cast removed. And she mentioned to me, she asked me to come help her walk from the living room to the kitchen. And I thought that was very odd. She has never asked me for that before. And I go and I ask her, so why do you feel like you need my help? And she says, I don't feel confident anymore. I'm scared to fall again. And knowing what I know and doing what I do for a profession, I took that very seriously, because fear of falling is also an indicator of, or it can be an indicator for a high risk of falling. That means their confidence isn't very good. And so when someone's confidence to mobilize isn't very good, they're going to move very stiffly and very cautiously. And sometimes that can make someone more prone to fall, just by virtue of their lack of confidence and being stiff when they move. So again, those 3 questions: are transfers getting harder? Are they avoiding walking? Are they needing more help than they were before they discharged from the hospital? And so those are signs that something is changing, and probably not for the better. That brings us to red flag or warning sign number 2. Okay, That's trouble standing up from a chair. And we're going to spend a little time here because this is one that I see all of the time at the hospital, and it isn't taken serious enough by other clinicians and by patients and their families. And so this movement, standing up from a chair, it seems simple. And it is simple. It's something we do every day, but it's actually one of the best indicators of overall functional strength. Okay? Standing from a chair requires, we call it a level change. You're going from sitting to standing. And so it requires leg strength, it requires balance, coordination, and endurance. Okay? And one of the things that you need to remember is that just because something seems simple doesn't mean that it isn't indicative of a high level of function for a patient. And so we'll get into more of the details here in just a second. But research in rehab medicine frequently, and I will vouch for this, I use this test all the time, but we use a chair rise test to assess mobility, both for in the outpatient setting, but especially in the hospital setting, and especially after someone is recovering or trying to recover from an illness. So if someone suddenly cannot stand up without help, it may indicate that their weakness is getting substantially worse. They may be fatigued, or they could have a balance issue that is making it difficult for them to coordinate the use of their body in order to stand up effectively. And so when those things are present, weakness, fatigue, and impaired balance, now your fall risk goes way up, okay? So the CDC shows that falls are one of the leading causes of injury among adults over the age of 65. So many of those falls occur, like I mentioned a few videos ago, many of those falls occur in the transitions from standing to sitting or sitting to standing, okay? And so that's why we use, it's the same test, but it's done in two different ways. We call it the chair rise test, or the 5-time sit to stand test, or the 30-second sit to stand test. And so let's go over those for just a little bit. So the 5-time sit to stand test is exactly just that. I test someone's ability to stand up and sit down 5 times in a row and how long it takes them to accomplish that. And so if it takes more than about 15 seconds, that indicates that there's substantial lower extremity weakness. They have possibly reduced balance or impaired balance. And if they don't fall under that 15-second threshold, that indicates that they are at a substantial risk for falling, okay? And here's another important caveat. That's being able to stand up and sit down 5 times without using your hands. Without using your hands. That is what the test, that's how the test is measured. The instructions are very clear. I want you to stand up and sit down from a chair 5 times in a row, as quickly but as safely as you can without using your hands. And guys, you would be surprised at how difficult that is for some people. And so if they must use their hands to accomplish a sit to stand from a chair, then that alone gives me good information about their general functional ability. Test number 2. And this is a variation of the 5-time sit to stand test, and that's a 30-second sit to stand test. And so it's very simple. We use it all the time. And instead of doing 5 consecutive repetitions, we count how many times the patient can stand up and sit down in 30 seconds. And so we have some ranges that we like to see for varying age populations. And so adults in their 60s should be able to complete 12 to 17 repetitions. Adults in their 70s, they should be able to complete about 10 to 15 repetitions. Adults in their 80s should be able to complete 8 to 14 repetitions if they are healthy, community-dwelling older adults. If you can only perform a few, or if a patient can only perform a few repetitions, or can't do it without using their hands, then that suggests that they have significant functional deficits. And I know that seems extreme, guys, but I see it all the time here in the hospital. I will test the patient's ability to stand up and sit down 5 times without using their hands, and they can't complete one. And they live at home by themselves. And to the best of their knowledge, they're doing okay at home. And while they may not have had an accident, they aren't equipped from a functional standpoint with the strength and mobility to be at home safely. And yes, that's extreme, and I'm going to take an extreme position on this. That doesn't mean that everybody needs to go to a nursing home that can't do that. It simply means that they need to address their strength deficits. Because not being able to stand up from a chair, something that should be an afterthought, not being able to do that at home and being by yourself, it's very unsafe. I don't know any other way to say it other than that. So if you know that you yourself have issues with that, or you're caregiving for someone, or you have a loved one that isn't able to accomplish that, that means action needs to be taken in order to remedy that. They need to get stronger. They need to be either in a fitness program to some degree, or they need to go to outpatient physical therapy so that they can have skilled supervision of a strength program, so that they can try to fill in that gap that they have. And so why does that matter? So after a hospital stay, okay, so again, I know I got kind of I niched down a little bit on those 2 tests because I find them very, very useful in the hospital. So remember, we're in warning sign or red flag number 2 of not being able to stand up and sit down without significant assistance or increasing assistance. And so that's because when someone's in the hospital, they may experience something called hospital-acquired deconditioning, HAD. It's a known term. It's a labeled term in geriatric research or in acute care therapy research right now. And so even a few days of illness or bed rest can lead to muscle loss, reduced endurance, and slower reaction times, all of which are a major concern for folks trying to return home safely. And so research from the CDC and health service research shows that these changes significantly increase fall risk during 30 days after discharge. And you're going to see a cycle here, guys. A lot of this research is saying the same things. These issues, if they're present, they are significantly correlated to an increased fall risk, significantly correlated to a readmission to the hospital within 30 days. And so remember, if you or your loved one are suddenly struggling to stand up without using your arms, it means pay attention. It means something needs to be done. Okay, so let's move on to red flag or warning sign number 3, and that's rapid fatigue during activity. Okay, it's one of the most common issues that we see after hospitalization is that, man, I just don't have the endurance that I had. I can't believe that being in the hospital for 3 days has made me feel so weak. I hear it from patients every day. Heard it today, multiple times from folks. I've only been here for 3 or 4 days. How weak can I get in that amount of time? And the answer is, you can get very weak in that amount of time. It doesn't take long. So when endurance drops, the risk of falls increase. And so if you notice that your loved one or yourself need frequent rest breaks, their ability to walk distances is becoming shorter and shorter because of needing a rest break, or they express shortness of breath with standing at the sink to brush my teeth really makes me out of breath. Standing at the sink to wash dishes really makes me out of breath. And fatigue that isn't correlated with exertion is a different kind of warning sign. And so I'll just add a little bonus here for that. If you start noticing yourself or your loved one, you're getting out of breath just for no apparent reason, that's a reason to call your doctor. Okay, that's a reason possibly to go to the hospital if it gets really bad. But what we have in view here is your activity tolerance is going down, or has gone down as a result of being in the hospital. And so that's red flag or warning sign number 3. If you start noticing increased fatigue with doing simple, basic mobility tasks, okay? Not, I went to try to walk 4 or 5 blocks and I realized that I got out of breath. That's not what we're talking about. Like I mentioned before, simple daily activities, and you start noticing, man, I really need to sit down, or I can't walk. I was walking from one end of my house to the other when I came home from the hospital. Now I can't walk from room to room before I have to sit and take a break. And so that's another thing to keep in mind. So here's the important message that I want you to take away from this video, and that is that just because someone made it home does not mean that their recovery is complete. A lot of times their recovery, their actual recovery is just beginning, okay? It's still in the early stages. Hospital discharge oftentimes simply means that they are medically stable to go home. That means there's no reason to keep them in the hospital any longer. Their blood pressure is managed, their illness is dealt with, their lab work looks good, we have them on the appropriate medication regimen, the bone has been fixed, the traumatic injury has been dealt with, and they are now stable to leave the hospital. But that does not mean that they have recovered functionally to the degree they need to in order to safely function at home. And so that a lot of times can take weeks or even months sometimes. And that is the thing that catches many caregivers and many patients off guard, is that it took longer than expected in order for me or my loved one to recover from being in the hospital for a week or 7 days, a few weeks ago. And so again, after discharge, here are the things you need to watch for. Do they need more help each day? Do they have trouble standing from chairs? Do they fatigue rapidly with normal daily activities? Okay. If you notice these changes, you need to contact your doctor, contact your home. If you have home health services, contact them or that agency and let them know, or any other therapy team you're involved with. Okay. If that's outpatient physical therapy or what have you. Or if you go to a gym and you are under the supervision of a personal trainer, they need to know that, because they may feel unsafe pushing you or progressing your fitness regimen. If you tell them things like, hey, I'm noticing these things, they may want you to get clearance from your doctor before continuing. So if your loved one, this is my request to you guys. Okay, if I can help you, if you have found this information helpful at all, and if you need more help, more guidance for some reason or the other, comment 72 hours down in the comment section, okay? And leave your question or concern down there. I'll try to get to them and answer them the best I can. And so in the next video, I'm going to explain why insurance sometimes denies rehab, even when families feel like it's necessary or needed, even when physical therapists and your care team think that it's needed. We're going to cover some of those details. So I hope you found this helpful, guys. Remember, if this content is helpful to you, hit a like, subscribe. I'm going to be at this for a while because there's so many topics that I can cover that hopefully one or more of them will be helpful to you folks. If you find yourself either in the hospital, just left the hospital, or you have loved ones that have been in the hospital, I'm just hoping to help you guys out and give you guys some of this knowledge that I feel like I share with local families here that I see in person. So just hoping to extend my reach and help anybody else that needs help. So let me know how I can help you in the comments, and we'll talk to you on the next one. Take care.